We are starting with the new school year and the situation that is stressing some. It's not about bus routes or even staffing.
It's about shots. Most kids in the metro go back to school in less than 2 weeks from now. Tonight, local health leaders say a lot of kids are not protected when it comes to vaccines. News 4's Gabriella Vidal explains why now, more than before, doctors are urging those shots in the arm.
As students and families get ready for the start of a new school year,
there's a little bit of a catch-up that we're playing now.
Pediatricians and local health agencies in the metro are trying to help families catch up on routine childhood vaccinations.
We have been really busy, which is amazing. I think a lot of people were a little bit hesitant to come to the doctor over the pandemic. So we're really happy to be welcoming these kids back.
Nationwide, they have seen notable declines in routine vaccinations during the COVID pandemic for many reasons, including things like it was harder to get to the doctor's office, especially during the early months of the pandemic.
Missouri's Department of Health and Senior Services did report a drop in back-to-school vaccinations among kindergartners. For polio vaccines, immunizations dropped from nearly 95% during the 2019-2020 school year to nearly 92% in the 2021-2022 school year.
Even the diseases that have long been gone, not on our radar, some of them are even coming back on our radar. So it's important to not just remember vaccines for the current, for COVID, for influenza, but we still need to keep measles and mumps and rubella and polio all at bay. And the way to do that is through keeping up with routine childhood immunizations.
Dr. Jessica Smith with Mercy Pediatrics in Chesterfield says the decline is not just limited to young children.
Definitely some of the older kids, and really I feel like the teenagers. I think a lot of parents were like, they're fine, they're doing online school, there's no reason to really rush them into the doctor. And so I do find that actually the teenagers are probably a little bit more behind in vaccines.
Families who may be hesitant about these immunizations or other optional vaccines being offered to children, like the COVID-19 vaccine, should speak directly with their provider.
In many cases, we're booked up. So don't wait to the last minute. Call your pediatrician, make your appointment.
Gabriella Vidal, News 4.